Hello everybody, and welcome to this session on neuromuscular ultrasound Knobology, or how to get a good image on your screen. My name is Nens van Alfen. I'm an associate professor of neurology in the Netherlands, and I hope you will enjoy this talk about the basics of ultrasound. First of all, we need to turn on the machine, right? So in this case, it's pretty easy. There's an on-off button right here. So I'm going to push that, and then in a minute or so, the machine will have been started. With some older machines, especially if you have some older software systems on there or not a solid-state disk, it can take a little while. So get familiar with yours and get a cup of coffee if it takes 5 minutes. In the meantime, while it's starting up, we can show you some of the other stuff. You can see that there's 2 probes attached right now. This 24 megahertz linear probe and a 14 megahertz, also a linear probe with a very broad footprint. Now, these probes are attached, I'm not sure if you're going to see that, and connected with a very large pin that plugs into the machine. Whatever probe is attached to the system is all up to you, right? You buy them when you buy the machine, and you need to choose whatever you want to use for the nerves you're going to scan. So here's an illustration about the relation between scan frequency and your resolution. Higher frequencies will give you a lot of detail in the image, but low frequencies are needed to get to deeper parts. So optimally, your probe will have a combination of both, and you need to choose the correct frequency range for the image you need to create. Here's an example. This is a 17 megahertz scan of the sciatic nerve at the level of the knee, but you can't really see the nerve right here. And it only comes into view when we add a lower frequency setting, such as this 9 megahertz setting. And then you can see the nerve pretty well because it's a little deeper at 2 centimeters. Now, if you hadn't seen the nerve already, it's highlighted in yellow here. Here's a few other probe-related tips and tricks. You should hold your probe like a pencil or a pen, and not like a spade or a fork. And wrap the cord around your neck or your arm or your little finger because it's very heavy and it tilts the scan head away from the ideal 90-degree angle. In addition, it's also a good idea to start scanning with keeping whatever's left on the probe to your left on the screen, because this is most easy to orientate yourself, especially when you're doing interventions with needles. So here's a graphic illustration of how not or to hold your ultrasound probe. And the cord, shown here. As a further tip, it is good practice to take good care of your transducer or probe footprint and cables. Please do not use alcohol-based solutions for this, as the rubber surfaces and casings will degrade. There are these special wipes for medical equipment that are usually very handy to clean your ultrasound machine before or after you scan a patient. Check your local hygiene department and the equipment manufacturer to see which solution suits you best. Finally, I can recommend to also take good care of the transducer cables. They are like the optic nerves of your probe, and if you drive over them or tie a knot into them, they will slowly go blind, degrading the image on the screen. So put them up and tuck them away in the hooks that are attached to the machine, so the wheels will not drive over them, and your equipment will be good to go for a very long time. Okay, so in this case, we're going to start out with the nice high-frequency linear probe in a second. You can see the machine has already turned itself on. We're going to use an emergency ID in this case because we're not entering any patient details, but if there were patients, you could find them in what's called the work list. But if you have an attachment to your hospital or practice system, the patient that will be scheduled could be shown here, and you could select the patient and import all the information you have there. So in this case, we don't have a patient, so we're going to start out with what's called an emergency ID, some temporary ID, so you can find the study details back. Now, it fills this out for us. We can press the start button, and it's going to come up with a screen. This already looks good to go, but the next thing you want to check is if you have the right probe connected. Now in this case it's configured to come up with that 24 megahertz linear probe, so that's okay. But if I wanted to say scan the sciatic nerve in the thigh region, at this point I would want to switch to a different setting. So I'd select the lower frequency probe to give me a little more image depth, and then in this case from that probe I would select what's called zenuw, which is nerve in Dutch. Okay, and then it would come up with this screen. Now you can see a preset will contain some things you've pre-configured to come up every time you touch that button. So in this case the screen has a standard depth of 4.5 centimeters. If you are scanning a person who is much larger than that, maybe because their BMI is very high, you might want to adjust it. Now this panel here has all sorts of knobs and toggles that you can use to optimize this image. So in this case, maybe I want to scan a very large person. I would want to adjust image depth up front. And this button here will let me do that. So you can just rotate the knob and choose whatever depth you want to see. In this case, 8 centimeters. There's not a lot on the screen right there, so I'm going to make it a little more interesting for you just by putting some gel on that probe. Now in this case, it's like putting toothpaste on a brush. Just put on a little stripe so you have some image artifacts there, so you can see what's going on. Okay, we're at 8 centimeters. Maybe you think, I want to see something that is at 7 centimeters deep. Well, there's a couple of other things that you need to adjust right there, because here, this little arrow here is the focus. This machine is set to have a single focal point. Maybe it can do multiple, but we're going to use this one focal point right now. But if something is at 7 centimeters depth, you need to adjust this. So I'm going to turn off the arrow here. The focal zone or point can be switched with this little wheel. And we're going to go to that 7 centimeter depth. But let's just say that you want to have a clearer image. Here's a button called 2D, and it's basically the volume knob on this machine. It's ultrasound, which means it's sound waves in decibels, and you're just turning up the volume by turning this knob. So everything that gets back to the transducer is sort of enhanced, and you can see the whole screen becoming brighter as I adjust the gain. Maybe you didn't see it the first time, but there is a little indicator here that says G, which is gain, and it says 100 right now. Okay, if I turn this knob back, you can see the screen going darker, meaning I'm adjusting the volume and tuning it down. I'm capturing the image that's now on the screen. In this case it's FRZ, which is a short for freeze or capture. If you push that, the image is still and you can start doing things on this screen. If I turn up the gain again, so we were looking here at 80 to 100, you can see the whole image becoming brighter, right? Okay. And this is the maximum gain. It's sort of glaring at you, which is really high volume, but then in visual terms. I'm going to turn that back again a little bit. So let's say 86. And there's something else you can do with these images, because there's another thing right here. It's called DR in this case. It stands for dynamic range. And it says sort of a translation of how hard or soft the image is. You know, this machine can see, I think, 255 shades of gray, much more interesting than the book, basically. But our human visual system can only do like 30. So there's a lot of information in here that we're not able to really discern or pick up. But we can see something that changes. Dynamic range is something that's on this touchscreen here, so you can see dynamic range, DR. And if we turn that down, the image becomes harder, right? So every pixel is sort of forced to choose between am I white or am I black? And if I decrease this a lot, every pixel on the screen will actually make that choice, and you will only have black or white pixels here, which is a very hard image. If I turn the dynamic range up, you see that a lot of grayscale extra levels are shown on the screen. So they are in the signal, but now they're also displaying here. And this is the maximum level, and it's quite soft. You know, all the grayscale tones are there. Now there's something else here in the screen as well, because you see these little toggles here. We talked about the overall gain, so the volume knob, but these are called time gain controls. And what they do is let you adjust the gain very specifically for a certain depth. Now, why is it called time gain control and not depth gain control, which would be a little more, common sense, is because the machine thinks that the longer it takes for the signal to return to the probe, so the reflection to return to the probe, the deeper it will originate. If we want to adjust the brightness in the deepest regions here, we can put these little levers here all the way to the right. You can see this white band coming up in the image there. So I'm pushing that back to the middle, and then the other one, slightly lower, and this one. And that's a very selective way of sort of highlighting a region of your image. If that happens to be where the nerve or the pathology is, it might make sense to highlight that part of the image if it's hard to see otherwise. Next thing we need to do is annotate this image, because now we have a beautiful image, but you don't know basically what it is. Is it left or right? What is radial? What is ulnar? So I'm going to pop out this keyboard here and type. So first thing I want to say is this is my left arm. You don't need to be very elaborate, right? An L is just enough. And this is a forearm. Okay, so I can just put that in place and turn off this. Now I might want to be more specific, so you're thinking, okay, I need to show this to someone who has no idea about the basic anatomy, so I also want to put in some other stuff, like this is the radial side, and this is the ulnar side. And then I want to annotate that I think that this is the median nerve. Now, we've annotated the image, and now you want to save it, because you want to show it to someone else or capture it for, quality reasons. So we're going to push this button, P1, has been configured to save the image to the system. Okay, it's now in the top right corner there. There's something else I want to do here, because I want to do some measurements. I want to know how big that median nerve is. So we're going to push this little button here with the calipers on it that says measurement in this system. And it comes up with a distance. You can see on this touchscreen there's lots of things you can measure. I want a surface area, so I'm going to push the area button. And the method it has chosen for me as a preset now is ellipse, which is what I want, but just to show you what else there is, you can do a continuous trace or some other stuff like the cross or the spline trace. I want the ellipse, so this is fine. So I'm going to put this little, this little cross on the screen in the nerve within the epineurial rim, as we are used to. And we're going to go across. So you sort of split the nerve in half with your measurement tool, push the button to fix it, and then collapse until it fully encircles the interior edge of the nerve. Now, when I'm satisfied with my measurement, I push the button once more, and it says it's 0.06 square centimeters, and that is what I wanted to know. Okay, I'm going to capture this image again. And if I want to look at these images, see if I captured the right thing, I can turn on the selection tool here and just capture them there and put them on the screen again if you want. So double click, and there it is. This is what we've captured. We can also capture a video. So let's say I want to do that. I press the video button. I'm going to scan a little bit back and forth. I'm going to turn it to a longitudinal image to have the median nerve in view here. So a little bit out of gel there, but there it is. Okay, going to stop the video. It's going to save it for me in the same location. Can press that selection tool again. Comes up again, and here's your video for review. I would advise you to capture any pathology you think you're seeing on video, and both in a transverse and longitudinal view. because that makes it a lot easier to review afterwards. In the end, you have scanned your patient. You will want to save those images and videos to, I think, the electronic patient record, or if you don't use that yet, you want to sort of capture them in a way that can be saved with another type of record, such as a paper record. Now, in this case, first thing we need to do is end the exam. So there's this button here, and if I push it, it's going to save everything from that first patient, or the emergency ID that I just put up here is this date, and this is the final time. So this is the exam that we just did. And you can reselect that and review it later on if you want. But you can also choose to transfer it to a server, for example, or a USB key, if that's what you're using. So let's finish that again. And let's say that we want to transfer this to some other location. Now, usually this works via a patient list or patient browser like this. We're going to select one here. This is the one I want to transfer. You can see what's in there. So these images, they actually come up for review. And now I need to tell it where to go to. So we're going to send it to, well, let's see what we can do here. We can do a DICOM format, which is of course standard radiology computer format, or to something that you could right away review on your own personal computer, like JPEG images and a type of video file like Windows Media 9. Okay. If I were to do this, I would insert the USB key, which needs to go here in this case, and would send the images there. Or I could have our IT department configure this DICOM flow to send it to a, well, radiology server or whatever you're using for your electronic health records. Just make sure that you do archive these videos and patient files also externally, because otherwise if the machine crashes for whatever reason, you have a, well, recently in our area we were flooded, for example, then all your images will be gone. And I'm not sure about every country in the world, but for example, in our country, we need to save these images for like 15 years minimum with the other patient record items. So okay, now we set up the whole machine and we're ready to go. I put some gel on the probe, and I also outlined the nerve I'm going to scan on the subject. You don't need to do this, but it's just a trick to keep you visually aligned about what you're going to do. Next thing is that for me it's most convenient to have whatever is left on the probe on the left side of the screen. Now if you only use one machine, usually your favorite probe and setup will have some sort of marker like this vertical stripe here, indicating whatever is left. But some trick that also works is you can just tap the probe with a little gel on it, and you can see that the screen moves, which assures you that whatever is left here is going to be left there, and that's easy to orient. So next I'm going to put the probe on wherever I think the nerve is. I outlined it here for you. And now we get an image on the screen. So I put the probe on the skin again, and what I try to do is get an exact 90-degree angle to whatever I'm scanning there. And remember, not all nerves are parallel to the skin all the time. They sort of go deeper, come up again. So you need to adjust your probe position. And if you do that in this direction, it's called tilting. So what's going on here? Well, your ultrasound machine sends out sound waves, and they will only produce an image on the screen when they are reflected back from whatever you're looking at an exact 90-degree angle, returning to the probe. If they are deflected, like in the middle of this slide, no sound will get back to the transducer and no image will show up on the screen. Finally, the probe sound wave can encounter something that's smaller than the wavelength of the emitted frequency, scattering the image. And this is the image you would get when you scan a liver or thyroid or a very dystrophic muscle. In summary, you do need to keep that 90-degree angle to whatever it is you're scanning. And if the nerve will go obliquely under the skin, you will need to adjust that probe angle to keep that exact 90-degree angle. Here is a short image example of what that looks like. You see a 90, a 60 and 45-degree angle here. And at this point, the median nerve is running parallel under the skin. So if I put up the next slide, you can see what happens when you tilt the probe. On the left here is the median nerve just prior to entrance of the carpal tunnel at an exact 90-degree angle, and you can see the epineurium and the fascicles in the nerve in the top middle of your screen there. But if you tilt the probe, I don't even think it is 60 degrees at the point that is shown in the photograph, you can see the whole nerve image sort of disappears, leaving a black blur in the image. And there is no amount of gain correction that can undo the effect of this wrong scan angle for you. Here's yet another example of the interaction between the beam and the image creation. Here you see the peroneal muscles over the fibula on the lateral side of the lower leg, and there is a black vertical stripe in the middle of the image that is actually a very thick fascial structure between the anterior or lateral and posterior compartment of the calf. But because all the sound waves are running parallel to that fascia, nothing is being reflected or deflected here, leaving a black line in the image. And this effect is also often seen in skin scars that will also show up as these black vertical lines in the skin. Because you cannot get a 90-degree angle to that structure, you cannot get the probe inside the skin. Now let's go back to the median nerve, mid-forearm. And like this, it's almost impossible to see the nerve. So I can see I'm still on the skin, and I can see the bone underneath. Here are the bone edges. And I can see some fascia between muscles. Okay, that's great. And this is probably a blood vessel. So if I would want to check that, I could put a color Doppler in, right? There is the blood vessel. Where is that nerve? Well, then again, you need to tilt. And sort of tilt back and forth until you see the nerve here coming into view, right? So I'm tilting now. Here it's very clear. Tilt a little more, it's completely gone. And here it's also gone. So if this happens when you're scanning, let's say we come from this very distal area near the wrist, going up to the elbow here, and all of a sudden, oops, the nerve has gone out of view. Just stop right there and tilt. Because if you're not doing that, you're going to lose the nerve. And if you lose the nerve and you're going to scan, then you have basically no idea where you're looking. And you certainly can't see pathologies. Do that one more time. There's the nerve on top there. Just put the arrow a little bit lower here. Into the carpal tunnel and adjust. Moving, it's getting dark. Adjust. Move again. Adjust again. And with this, it's still possible, if you know where you were looking at, to see the nerve. Now, at this point, it's really getting a little complicated for this probe setting. So if we wanted to go further here, I think we should switch to a lower frequency probe or a lower frequency setting, if that would be possible on this probe. Now let's go back here, because I've set the depth setting here to 3.5 centimeters to show you that nerve between pronator teres at the elbow. But right now, we're at the much more distal site. We're here at the wrist. And now we see all these artifacts. This is a bone shadow. There's nothing beneath here. It's just false shadows, and here the same. And a lot of the image is actually taken up by something that you do not really want to see. So we need to adjust the depth again. Something else that we can do, which is depends on your machine really, is this machine has now been set to create a full focus. So you don't need to adjust it manually, but it will adjust to depth automatically. Keep everything in focus here, which is really nice and really advanced. But in a lot of machines, I can turn this off, you don't have a full focus option, and there will be a focal point or a focal zone. And in this case, you can see this little arrow on the screen right there. I turned off the full focus setting. So now the median nerve is not really in focus, right? I need to move this up, and there's a scroll wheel here that allows me to do that. And then basically you would want to put that focus point right underneath or right at the lower edge of whatever it is you're looking at. So here's one more still slide in this presentation. These are two images showing you the effect of a correct focus on the left. The green triangle is the focus point, and an incorrect focus on the right. And you can see the whole image goes blurry. So please adjust the focus if this is manually needed on your machine. And with this, we're at the end of this Knobology session. I hope you enjoyed and found it practical for your own scanning experience, and I thank you for your attention.